Questions remain following Tiger Woods' arrest on a DUI charge. The golfer blames an unexpected reaction to prescription medications. Woods underwent back surgery 5 weeks ago. Dr. Scot Ackerman joins us now live on the phone for some perspective. Doc, his explanation, medically plausible?
Absolutely, Bruce. Patients that undergo surgery, orthopedic surgery, back surgery, which is what he had, are on all sorts of medications afterwards. And a lot of these medications can interact, and these medications can make it such that you drive in a way that may be perceived as variable.
So when someone is stopped, are there physical differences, physical characteristics that would clue somebody as to whether or not this is a DUI or a reaction to prescription meds?
Right. It's hard to tell the difference because DUI stands for driving under the influence. It's not necessarily driving under the influence of alcohol. It could be under the influence of anything. And we're not supposed to be driving when we're impaired. And being impaired can be caused by alcohol. It can be caused by narcotics. It can be caused by anything.
Let's take a look at his surgical history. He has had 4 back surgeries in the past 3 years. April 2014 was the first, 2 intervening ones in September and October of 2015. And the last one was just back in April, about 5 weeks or so ago. What kinds of pain medications might he be on, and what would the typical reactions be?
Well, since he's had 4 surgeries, he's probably had pain in between all the different surgeries. Otherwise, he wouldn't have needed to have repeat surgeries. And the sort of medications that we put patients on like this are frequently opioids like Vicodin or oxycodone or hydrocodone and those sort of drugs. And these drugs, in addition to these drugs, we also put patients on muscle relaxers or anti-anxiety medications to help the muscles relax a little bit. And all those drugs can react with each other, but specifically with the opioids, they can make someone anxious, they can make someone irritable, they can make someone nauseated. And when you're having those feelings and it's late at night and maybe you've had a drink or maybe you've taken some other medications, it can certainly affect your reaction ability.
And as you take a look at his mugshot from his arrest down in Jupiter, can you tell anything from the physical characteristics that would lead you to conclude whether or not this might have been alcohol influenced or prescription med related?
Yeah, well, it would just be conjecture. You know, if you were arrested at 3, if you were taken in at 3 in the morning and they took a mugshot early in the morning, you'd look disheveled too. I just know that I would. So it's hard to make judgment from that. I looked very closely at that picture, and there's other pictures. There's pictures comparing it with old pictures of Tiger or different pictures of Tiger, and it's hard to make those comparisons. It's not really fair to, because the other pictures are when he was younger, when he was happier. He's been up all night. He looks disheveled. And it's hard to make conjecture from that.
And 5 weeks out from surgery, still likely that he would need pain meds?
Oh, absolutely. He said, as you mentioned, he's had 4 surgeries in the past. So these surgeries have not always been successful. And who knows how this last surgery's been. He probably is in some pain. He did say, however, that this last surgery was miraculous and he felt much better after this last surgery. But you can still be on some pain medications. And you can also be on antibiotics. And antibiotics will make you nauseated and irritable as well sometimes, and they can interact with pain medication.
Dr. Scot Ackerman, thanks for your perspective here this morning. Appreciate you. You have a good day.
Thank you, Bruce. Good talking to you this morning.